On October 1st, 2013, the Affordable Care Act's healthcare marketplace went online, and citizens who were previously uninsured due to issues such as high monthly premiums or pre-existing conditions are now able to shop for health insurance just as easily as they would shop for a TV on Amazon. And although the Affordable Care Act, also known as Obamacare, was signed into law in March of 2010, there are still many citizens who are confused about what that means to them. We spoke to WCSU professor and former journalist Dr. D.L. Stevenson to gain some insight on how Obamacare affects you.
In a nutshell, everyone is affected by this, but the people that will be most affected by this are the people who do not have insurance right now, who have to go to these exchanges to find insurance and to find out whether they're eligible, say, for Medicaid, Medicare, or if they have to purchase insurance on this exchange.
On October 1st, millions of Americans who don't have health insurance because they've been priced out of the market or because they've denied access because of a pre-existing condition, they will finally be able to buy quality, affordable health insurance.
Those who don't have insurance through an employer but who have insurance have either a health plan or what's called major medical. Major medical does not include payment for routine exams.
The issue is that all health insurance has to have that minimal creditable coverage. I don't really know of, and I can be corrected, of too many employers who aren't offering health plans. That's what makes it so attractive. People like the idea. So for example, you have a health plan. You go to the doctor, right? Something you don't feel well. You might pay $10 or $15 for the visit. That's a health plan. You're going in to get a checkup. You're going in to see what's wrong. If you had major medical, more than likely you'd end up having to pay that out of pocket. And if there was something major, like you needed a surgery, you needed to have your appendix out, then your insurance would pay a percentage of those costs, maybe 80-20.
Let me just give you a few examples. Because of the Affordable Care Act, more than 100 million Americans have gotten free preventive care, like mammograms and contraceptive care, with no copays. Because of the Affordable Care Act, 3 million young adults under age 26 have gained coverage by staying on their parents' plan.
To begin searching for healthcare, you can go to accesshealthct.com to browse the healthcare exchange. But how exactly do these exchanges work?
First of all, I want to make it very clear to people in Connecticut that these are going to be state-run, state-by-state exchanges. People will, and they're very easy to use, to be honest, and there are phone numbers. So that people should probably, if they have any questions, go to their websites, or they should go and call the numbers listed at those websites and ask questions. And then there are 3 types of plans. They're bronze, silver, and gold. And just based on the metals that they're named after, they're going to have more perks and more benefits, and then they're going to be more costly. The gold plan is going to be more expensive than the bronze plans.
With the Affordable Care Act officially declared a tax by the United States Supreme Court, it affects every American citizen differently. It's important for each and every person to stay informed and know how Obamacare affects them. This is Nick Skronsky with WCSU News, Election Connection.